Today, my colleagues from the Colorado State University College of Veterinary Medicine will be showing the placement of a radiopaque polyurethane esophagostomy tube in a yellow-footed tortoise. My name is Clara Go, and we have no conflicts of interest to disclose. Materials required include antiseptic scrub, a surgical sponge, a number 15 surgical blade, needle holders, surgical scissors, non-absorbable 3/0 nylon suture, and surgical tape. MILA esophagostomy tubes are available in numerous sizes and come with a removable feeding adapter. Pictured here is an 18 French. An associated tunneler device is used for tube application. Begin by unscrewing the collar on the tube and removing the feeding adapter. Cut 2 centimeters off the tube to ensure a secure attachment to the tunneler, but no additional length at this time. Pre-measure the tube from the Chelonoidis mid-carapace to the desired location of the tube on the esophagus and mark the tube accordingly. Mid-carapace is used to approximate the location of the stomach. Once sedated or anesthetized and placed in right lateral recumbency, an IV catheter can be placed in either the right or left jugular vein, in this case the left. The esophagostomy tube can be placed either dorsally or ventrally to the left jugular vein, depending on the species. In this case, it was placed dorsally. Disinfect the incision with antiseptic scrub. Begin by passing the uncut end of the tube into the oral cavity aborally down the esophagus and into the stomach. Insert the shorter end of the tunneler through the oral cavity alongside the tube and place the end of the tunneler approximately halfway down the length of the neck, taking care to avoid the jugular vein. Rotate the tunneler to angle the tip laterally, and although this cannot be visualized, it can be confirmed via palpation. Identify the jugular vein and ensure the tip of the tunneler is dorsolateral to the vessel. Apply pressure to raise the tip of the tunneler dorsolaterally towards the ceiling, moving vessels and nerves out of its path. Attach the cut end of the tube to the opposite end of the tunneler and secure the held end of the tunneler using a number 15 surgical blade. Create a 3 to 4 millimeter incision over the tip through the skin and muscle of the left lateral neck. Push the skin down and navigate the tunneler upward through the incision. If necessary, the incision can be lengthened if there's too much resistance for the tube to be manipulated easily. Gently guide the tunneler and tube in a cranial direction until the tube flips and moves into proper position, lying linearly in the esophagus. In the current video, timing of the flip of the tube can be noted right here, and then the tube can be freely moved in and out of the site. Temporarily tape the tube in place and confirm correct placement with radiographs. Contrast could also be used to confirm placement of tube within the gastrointestinal tract. Once correctly placed, detach the tunneler and cut the tube to the desired length. Reattach the collar, then reattach the feeding adapter. Once the tube is adequately secured, suture the tube in place. In this case, a non-absorbable 3/0 nylon suture was used in a purse string pattern around the tube and then extended into a finger trap. The tube can further be secured using a tape butterfly and 2 simple interrupted sutures if desired. Secure the tube to the dorsal carapace with tape or other material. Prior to feeding, ensure patency by flushing the tube with water. Initiation of feeding can begin once the chelonian is fully recovered from anesthesia at the clinician's discretion.